You are most welcome, ladies and gentlemen, to your power behind the voice on Tuesday Night Anatomy with Daniel Okwan. Yes, we are still in the era of anatomy of clinical importance. And my friends, this is today's case study. A 9-year-old boy, yes, who presented with, of course, acute tonsillitis. And whenever I talk about tonsillitis, without, yes, referring to the particular one, I'm talking about a palatine tonsil, okay, presented with acute tonsillitis, okay, had excruciating pain emanating from the middle ear. Now the question is that, what nerve is responsible for the referred pain in the middle ear? And so this is where you have to understand all these concepts very well. Now there could be that kind of referred pain. And referred pain is a result of that kind of confusion of the brain to specifically locate where, the pain is emanating from. Yes, due to, of course, some nerves, okay, emanating from the other areas, or one nerve supply maybe two different locations, for instance, that may result in that kind of referred pain. Now, this patient presented with acute tonsillitis. And so whenever you look at the palatine tonsils, then one thing that we need to understand is that just like the lingual tonsil, yes, palatine tonsil, one thing is going to happen is that it will be supplied by, of course, the glossopharyngeal nerve. Okay, so the glossopharyngeal nerve, which is the 9th cranial nerve, is responsible for giving or for carrying this kind of general sensation from, of course, palatine tonsil. Okay, so that's the first thing that I need you to understand. So it tells me that then there should be one more nerve, okay, which will also go inside this middle ear cavity, which is also a branch of this 9th nerve, which is the glossopharyngeal nerve, okay, that may lead to that kind of confusion in the brain, okay, leading to that referred pain in the middle ear. And my friend, yes, and the branch of that nerve, okay, of this glossopharyngeal nerve is, my friend, something we call the tympanic branch of the glossopharyngeal nerve. Tympanic branch of the, and when we talk about tympanic cavity, then you understand the middle ear comes in here. So tympanic branch of the glossopharyngeal nerve, my friends, that nerve which also has an eponym, Jacobson's nerve. So sometimes you may not see tympanic branch of the glossopharyngeal nerve, you may see Jacobson's nerve. And my friends, is that Jacobson's nerve or that tympanic branch of the glossopharyngeal nerve that is responsible for the referred pain, okay, that we experience when someone presents with this kind of acute tonsillitis. Okay, that's one thing I want you to understand. So one thing that I want you to know is that once this Jacobson's nerve carries it, the point that we need to understand is that the nerve, okay, will go through, or the sensation or the message will go through what we call the superior glossopharyngeal ganglion, and then eventually gets to the what we call the contralateral cortex of the brain. So for instance, if the acute tonsillitis, yes, it was to the right side, okay, then what will happen is that the contralateral cortex, okay, of the brain, the left side, yes, will perceive that pain, okay, emanating from this middle ear that we're talking about. If it's from that of the left, yes, the pain, okay, will be, perceived, okay, will be interpreted by what we call the right, cortex of the brain. Okay, so this is what I want to tell you so that you understand that, yes, although this person was experiencing tonsillitis and we expect that pain from that area, yes, still the pain is of course referred in the middle ear cavity. And that's the anatomical basis which I want you to understand. I'm very grateful for your time this evening. Have a good night, all of you, and may the good Lord richly bless you. Amen.